our first question. I do want to just throw into here that there is a trigger warning here. The following question will contain information and discussion around domestic violence, which can be distressing for some people. So if you want to sit this one out, give us about 5 or 6 minutes. We should be through, actually probably 10 minutes by the time we go through some of the answers as well. Again, exercise caution, prioritise your mental health and well-being, particularly just before this exam. And if this is something that you think could apply to you, I strongly encourage you to seek out support from your own professionals, your own GP, or some of the health lines or domestic violence advocacy agencies. I've got some of the details there for Lifeline and the National Sexual Assault and Domestic and Family Violence Counselling Line. Okay. Of course, we are getting ready now for our first question for tonight. 2 minutes on the clock, and your time starts now. Janaea Williamson, a 30-year-old Indigenous woman, presents to your rural general practice with multiple injuries, including bruises and lacerations to her face and arms. She appears distressed and hesitant to share information. On examination, there are visible signs of recent injuries on her face and arms. Her vital signs include temperature of 36.9, blood pressure of 130/80, heart rate of 92, respiratory rate of 18, and BMI of 26.5. The remainder of her examination is normal. What questions would you ask if you suspect domestic abuse? Provide 3 specific questions. All right, how did you all go? Would have been much better if I hadn't gone to write things and not put it on pen mode and instead skipped to the answers. But for those that didn't see the answers specifically, so this is taken directly from the RACGP Red Book around domestic violence, and there's actually a specific section around Indigenous domestic violence as well. So some of the recommended questions are, has your partner ever physically threatened or hurt you? And that's taking that direct approach, kind of punching straight to the information you're trying to get. So for that would be with 2 marks. If you wanted to take a more indirect pathway, is there a lot of tension in your relationship? Or how do you resolve arguments in your relationship? Teasing out more, trying to see if they're able and willing to discuss this further. Next step would be to have a soft, direct questioning of sometimes partners react strongly in arguments and use physical force. Is this happening to you? Which again would be 1 mark. Are you afraid of your partner? Would be an indirect marker. And I think that's a particular one that goes well with all the other ones as well, because has your partner ever physically threatened to hurt you, is still separate from the are you afraid of your partner, because there can still be other forms of abuse as well. And of course, the acknowledging or allowing to explore through violence is very common in the home. I ask a lot of my patients about it because no one should have to live in fear of their partners. Now, this one is a little bit tricky because it is hard to diversify around the provided answers, but it's teasing through different forms of domestic violence, be it psychological, physical, threatening, or financial as well. And financial is not really covered in here, which probably could be explored. And even though it's not in the recommended answers, I think if you mention something around do you have financial independence, and I can actually see excellent response in there. Someone's popped it in. I think that would definitely get you marks in the actual exam. All right. Otherwise, some fantastic answers there as well, and I think you guys would do well on that one. But of course, the show must go on. Let's get through to the next question then. We'll put 2 minutes on the clock, and the time starts now. On further inquiry, she reveals that she has been experiencing physical violence and abuse within her household. Janaea discloses that her partner has been physically assaulting her regularly, and she feels trapped and scared. She mentions that this has been happening for several months. She denies any history of mental illness or substance abuse. What risk factors can increase the likelihood of family violence in a rural Indigenous community? List 5 specific risk factors. All right, 2 minutes is up. Now, this is one of those questions where they'll feed you a little bit more information, and often they're actually supplying you with hints towards some of the answers there. As I can see, some of you have picked up from the chat. Well done. Again, taking direct from the Indigenous perpetrators of violence, prevalence and risk factors for offending, publication from the Australian government with involvement from RACGP as well. Intergenerational trauma or unresolved historical issues is definitely going to be a factor in terms of the Indigenous rural communities. Persisting racism, ethnocentrism, either way you'd word that. I think if you had any mark that's kind of touching on that aspect, I think it would get you the mark there. Socioeconomic disadvantage, geographic isolation. Again, they've already given you some of the information here in terms of you're in a rural general practice setting. High unemployment rates, substance abuse, alcohol misuse, and I think you would have to be a little bit cautious using both of those answers. I'd probably say there's probably going to have some grouping there, and so given we do have lots of other things we could be choosing, I would probably separate those out or just omit one and focus on other aspects. Limited access to educational opportunities, breakdown of traditional family or community structures, boredom, peer group pressure, and payback against transgressions. So I can see some brilliant answers coming through here. Absolutely smashing it. Low socioeconomic, substance abuse, poor literacy, intergenerational trauma, and stress from financial constraints. Again, we've got access to alcohol. Crowded living conditions would be, I think, community specific, but I dare say in a lot of rural Indigenous communities, you would probably get marked for that one. Financial instability, lack of access to health services, definitely. Lack of access to schooling for children, again, perfect, touching on that educational aspect. And I think that one's a little bit behind. Sorry, that's okay. We will keep moving on. So again, very happy with the answers there. I'm really loving the succinctness, the specificity of the answers, and the diversity in responses as well. So absolutely nailing it tonight. Well done. Of course, we have more questions to go, so let's get to it. Another 2 minutes on the clock, and your time starts now. Janaea is adamant she does not want to involve the police, but has come to the realisation that she immediately wants to leave the house for her safety. There are no children involved. What would be your immediate management for Janaea? List 4 management actions. All right, so 2 minutes is up. And this is sadly one of those things that we often, well, not uncommonly come across in general practice. And working in a rural setting myself, this is something that we deal with on a not infrequent basis. So I think a lot of people would have some experience in here, but similarly though, I think a lot of people could go through their training without having significant exposure to these kinds of presentations. And this is where it can be handy to have a quick flick through some of the guidelines, and I've got a link for those who are interested in that coming up. Now, one of the first traps here is that she's adamant she does not want to involve the police, so any response saying to contact the police or make a police report would not be worth any marks. If that line wasn't there though, ripe for the picking, and I would actively encourage Janaea to be making a report to the police. So the things that would get you marks, of course, would be ensuring the immediate safety of the patient by assessing the level of risk. That's 2 marks. So that would be checking would the perpetrator, and sorry, I've just made the assumption it's a he, but unfortunately it most commonly is. So would the perpetrator of the violence have a way to track? Would they have access to firearms or means to cause threat to life or limb? Those kinds of questions, and there is a flow chart to kind of step through for this as well. Offering support and referring to a specialised service such as domestic violence support organisation or Indigenous specific services, and exactly what you would answer for that or how you would prefer may differ based on where you are and what services are there. You can list specific services, and I think showing that you know what services are available in your area. The risk you run with that can be if the person marking it's not familiar with that service. However, here, for example, I would be referring to the Mallee Family and Domestic Violence Counselling Service. And so thankfully it's in the name, so it kind of takes some of that ambiguity away. If you are going to specify a service that may have a particular name but doesn't specify exactly what they do, you could put in brackets there domestic counselling service or local support organisation. And that shouldn't give you overcoding. That's more of a clarifying local service. You could leave it generalised and just specify, as it has here, specialised domestic violence organisation. But I think it can show that little bit of polish. It's damned if you do, damned if you don't, unfortunately. And it's one of those things we'll never quite know for sure. It really would come down to the person marking that individual question. Now, of course, liaise with local Indigenous liaison officer, and this would have to be with the patient's consent. Unfortunately, there can be some tricky politics at times in terms of clicks in different services, and so that would be something you would have to explore with the patient directly. Provide a safe environment for open or non-judgmental communication. Document the injuries, and you could refer for forensic examination. This would not necessarily be involving the police. It may be a trip to the emergency department, or in our community, for example, there's one of the general practitioners who is trained in forensic medicine that performs all forensic examinations for the region. Developing a safety plan to address their immediate needs is, of course, definitely something I would be wanting to see there. So, again, some fantastic answers coming up there. So, connecting to the local services, escape plan, non-judgmental approach. Pardon me. Validate her concerns. I think you might be getting a little bit of lack of diversity between validating concerns and non-judgmental approach. I get that they're trying to tackle different things, but I think there's probably other things there that I've been wanting to tackle preferentially. But certainly as the list is kind of getting a bit longer, it sometimes gets a bit trickier to think of things to put in there. All right. Let's get on to the next question. Oh, before we do, sorry, I did promise you a chart. So this is taken directly from the Abuse and Violence publication from RACGP, which does show a really fantastic outline for approaching domestic violence patients. So again, asking about it, and if they do disclose, you can perform your risk assessment. Children are at risk changes the picture because it's the one time where you may go around the patient's wishes and still make a formal report if there's any concern of the child's well-being. If they say, though, no children in the picture, if they consider they're in immediate danger, then it's a straight referral to police or specialist domestic violence service. Most regions will have a crisis service as well, who do specialise in very quickly and very securely removing victims from this setting. If they declare that they're not in immediate danger, though, then it's accessing other services, if they are or aren't, and getting referrals through in a less urgent manner. Again, if you haven't checked it out, this is the publication to have a look for. Very quick Google will get you there.